The COVID-19 pandemic has affected most, if not everyone, in this country. Stores are closed, businesses are shut down, and the economy is suffering. Despite these things, this is not the time for reversal in the quarantine order, as the peak of the disease has not been reached yet. Additionally, political discourse is obstructing the rise of stability in this country, and that stability is needed to reopen the nation. Finally, the proper safety measures must be met before any changes can occur to this current standard. Although a reversal in the quarantine order may soon occur, the peak of the COVID-19 has yet to be reached, and thus an influx in new cases could occur if safety limitations are lifted. According to a report by James Curum, which I accessed on May 1st, over 3 million people have contracted COVID-19, and 250,000 of those people have died from coronavirus complications. A large majority of these people are sick, elderly, and young children, unfortunately, newborns. Additionally, in an article written by Kong Vong, which was accessed on the 28th of April, the peak of the virus hasn't been reached yet. He states that with the strict adherence to the current social distancing policy, the real peak will occur sometime mid-May, if not later. This, of course, means that the reopening of the country could cause more harm than good, as more people will be exposed to COVID-19 than if the country had stayed closed. Regardless, the surge of new cases will inevitably cause an unprecedented strain on the healthcare, and they may not be able to sustain their ability to treat and quarantine patients. And Flaherty describes this in her article, which I accessed on April 26th, and further states that for the nation to return to normal, the healthcare system needs time to prepare for an influx in patients. With increased tensions during the quarantine, many have turned to political fervor in an attempt to resolve the crisis we're going through. The rising political tensions, which were an unfortunate side effect of the quarantine, as well as the 2020 election year, prevent this country from stabilizing. Political discourse has led to widespread rashness in matters of safety measures and standards set forth to protect the people of this nation. In the past, we've seen several accounts of political fervor during times of crisis. As described by Charles Blow in his article, which I accessed on April 28th, the Spanish flu of 1918 saw a rise of extra-party tensions despite the fact that it was only a midterm election year. Because of these tensions, parties raced to find solutions and race towards options to the pandemic, and often cause unnecessary division between their parties as well as within their nation. The rise of political interest has directed attention away from the interest of safety measures and procedures that have become extremely relevant to our nation during this crisis. The changes in social structure that have occurred due to the COVID-19 pandemic, there are many standards to uphold and procedures that prove monumentally effective when combating COVID-19 on a large scale. These include social distancing, regular hand washing, and the use of self-isolation. In a CDC report that I accessed on April 28th, the CDC states that the airborne nature of the disease's spread requires a social distancing of 6 feet minimum. This distance is to be held in the weeks and months following the reversal of the quarantine order. In another article written by Nicole Chavez, which I accessed on April 28th, she states that the need to remain vigilant and ready for self-isolation is stressed now more than ever, as states declare that a reversal in the stay-at-home orders will be coming in the following weeks. Additionally, in Josh Dawsey's Washington Post article, which I accessed on April 30th, he assures that the CDC and FEMA have developed plans for the scenario of opening the country, regardless of when those plans would be enacted. This quarantine has caused significant amounts of suffering, from small businesses to religious gatherings, campuses to hospitals. The economy is in turmoil, and yet it is not safe to ignore these safety measures and venture out en masse. Although the economy needs stimulus, the safety of its people will always be this nation's priority. As such, we should be cautious as we approach the day we open our doors and return to our places of work. We should be vigilant in our standards and procedures that were set in place to protect us, but first and foremost, we must listen to the words of those who have spent their lives devoted to the research of diseases and epidemics just like the one we are in. Thank you.